This is the first in a series of videos providing information for the Caribbean and African communities during the coronavirus pandemic. There is a lot of information out in the public forum about COVID-19, and our understanding of the virus is rapidly changing. This often doesn't allow us to pause and understand some of the basics. Additionally, sometimes this information isn't relevant to all cultures and it isn't reaching all of our communities, and it's not always in a form that's accessible. With this in mind, the Caribbean and African Health Network have decided to make this video with all the basics you need to know about COVID-19.
Viruses are small bugs that you can't see with the naked eye, but if somehow they find their way into your body, can cause you to become quite ill. Now, there are many different types of virus, but the one responsible for the current pandemic is from a family called coronaviruses. And they got that name because if you look at them under a microscope, they actually look like they have a small crown around it. Now, the virus responsible for the current pandemic is actually a newly discovered coronavirus called SARS-CoV-2, and it causes a disease that we now call COVID-19. When a person with COVID-19 coughs or sneezes, droplets containing the virus get dispersed into the air around them. The most common way for someone to acquire the infection is for you to be so close to them that you breathe in those infected particles. In addition, when they cough or sneeze, the droplets land on surfaces around them. If you then go and touch these contaminated objects afterwards, and then, for example, rub your eyes, rub your nose, or put your fingers into your mouth, you can also be contaminated in that way. This is an illness that mainly affects the lungs. Common symptoms include a dry, continuous cough and difficulty catching your breath. People may also report having a high fever, extreme tiredness, and even the loss of the sense of smell. COVID-19 affects people very differently though. Let's imagine that you have 100 people who you know have COVID-19 infection. Out of those 100, you could probably expect 80 of them to have quite mild symptoms or no symptoms at all. With rest at home, they'll be fine within a few days. The other 20 we worry about quite a bit more though. They're the ones who are likely to have quite severe illness and need hospitalization. 5 of them will be so severe that they may even need to be admitted to the intensive care unit, and they'll need close monitoring and may even need assistance with breathing until their body is able to fight off the infection. 2 of the 100 will unfortunately die. COVID-19 affects people of all ages and backgrounds. However, there's emerging evidence to suggest that people from our communities are disproportionately contracting the coronavirus and are more likely to have severe forms of the disease. Research is currently ongoing as to why this might be the case, but it may not be surprising because many of us are likely to come in contact with the virus as we're often on the front line of essential services. We're also more likely to have close-knit communities and sometimes live in multi-generational households. In addition, in our communities, there are higher rates of pre-existing medical conditions such as heart disease, high blood pressure, diabetes, and sickle cell disease, which are known to put people at greater risk of becoming severely ill. Other people likely to have more severe disease are men, especially if they're older than the age of 55, and women older than 65 years old. Lung conditions like asthma and COPD also increase your risk of being severely unwell, as well as smoking.
The best advice is to stay home. We know that that's not always possible for many of us who are essential workers, such as health workers, teachers, social workers, and those in public safety and transport sectors. If you fall into those categories, however, or you need to travel for necessities like food or medication, there are still things that you can do to protect yourself and others. Number 1, keep 2 meters away from any other person. That's about the distance between both arms stretched out. Number 2, limit handling of objects as far as possible and bring an alcohol-based hand sanitizer with you to clean your hands when necessary. And number 3, as far as possible, avoid touching your face. And finally, as soon as you get back home, make sure to wash your hands thoroughly. This means washing for 20 seconds, making sure you're getting in all the crevices, ideally with warm water. A good dollop of hand cream between washes will help to prevent cracking. Firstly, do not panic. Remember that the vast majority of people only have mild symptoms. You don't need to go to a GP surgery, pharmacy or hospital. There is very specific official guidance from the Public Health England, which I'll read to you now. If you develop symptoms and you live alone, from the day your symptoms started, self-isolate at home for 7 days. If after those 7 days you're feeling well and you don't have a temperature, you can stop self-isolating. Even if you still have a cough, the cough can persist for a while after. If you still have a high temperature though, keep self-isolating until your temperature returns to normal. If you develop symptoms first and you live with other people, firstly, you need to self-isolate, as we've mentioned, for the same 7 days. But do remember that if you have to cough and sneeze within your house, make sure you're doing it into your elbow. This will help prevent spread within the household. Everyone in the household must stay at home and not leave the house for 14 days. The 14-day period starts from the day when the first person in the house became ill. You should seek medical help if after 7 days your symptoms aren't getting any better, your symptoms are getting worse, or if you feel as though you're not able to cope with these symptoms at home. To access medical services, visit 111.nhs.uk, which is the coronavirus service online. Alternatively, if you do not have internet access, call the NHS on 111. For a medical emergency, dial 999.
We've given you a lot of information in this video, and we hope that it will all be helpful. But while the situation is rapidly changing, you'll need an update from time to time. You can visit the nhs.co.uk website or Public Health England website for more information. Thank you for watching. Stay safe and stay home. Please look out for further Cahn videos where we'll discuss health concerns affecting Caribbean and African communities and do some myth busting around the coronavirus.